Good morning, everyone, and welcome. Thank you for joining us for our Make Black Moms Matter Legislative Breakfast brought to you by Healthy Starts Community Action Network and the Black Women's Policy Agenda. My name is Sherelle Fulton. I am a certified lactation counselor, a co chair for Healthy Starts Community Action Network, and a community health advocate, as well as a mother of two. The mission of Healthy Start is to improve maternal and child health and to reduce poor birth outcomes and infant mortality in Allegheny County. The goals of the Black Women's Policy Agenda is to build a coalition for long-term mobilization and systems change, enact public policies that improve social and economic opportunities for Black women, and to promote quality of life policies to secure health justice, affordable health care, raising the minimum wage, and the adoption of work and family equity policies for Black women and girls. We appreciate each and every one of you for being here. From constituent to legislator, we know that each voice should be valued, but in many cases, specifically in the Black community, there are individuals who go unheard every day, especially during medical treatment. This has translated to a rise in maternal mortality and morbidity in the United States. The maternal mortality rate in the US for 2018 was 17.4 maternal deaths per 100,000 live births. But for non-Hispanic Black women, there are 37.1 maternal deaths per 100,000 live births. The numbers are alarming to say the least. We felt it was important to bring the community at large together to discuss this growing issue and to learn about ways we can help reduce yet another issue that contributes to the death of Black women. The moderator for today's event is Healthy Start CEO Jada Sherrill. The panelists joining us today are labor and delivery nurse and founder of Her Birthright, Jamila Please, State Representatives Summer Lee, Ed Gainey, Morgan Cephas, Jake Wheatley, and Dan Frankel, all of whom are a part of the Women's Health Caucus, as well as Congressman Mike Doyle, who is a co-sponsor of the Black Maternal Health Momnibus Act of 2021. If you have questions for today's panelists, please submit them in the Q&A chat. We will do our best to have them answered, and if we're unable to have your answers today, we will send a follow-up email with those answers. Again, thank you for joining us. Without further ado, I bring to the stage founder and director of the Black Women's Policy Agenda, Rochelle Jackson.
Good morning, everyone. So glad to be here with you all today. Again, my name is Rochelle Jackson, and as Sherelle stated, I am the founder and director of the Black Women's Policy Agenda. The Black Women's Policy Agenda has joined forces with Healthy Start to facilitate this very important dialogue today about the health and well-being of Black mamas and babies. And we are pleased to be joined today by so many distinguished guests, including Black mamas. And I have the honor of introducing our keynote speaker for this morning. Our keynote speaker for today is Representative Morgan Cephas, who represents the 192nd District in Philadelphia, PA. She was elected to serve her first term in the Pennsylvania House of Representatives in November 2016 and is a native of West Philadelphia, as well as a product of public school. Morgan has worked tirelessly in the public sector, building her community block by block, and at an early age, she realized that safety, job security, access to quality educational and multi-generational recreational activities are key components to ensuring a neighborhood's success. In the General Assembly, Morgan's priorities are creating a more equitable Pennsylvania by increasing educational opportunities and career pipelines for youth and young adults, creating jobs through business expansion, providing resources to seniors, expanding access to healthcare to improve health outcomes, and ensuring women and girls are a priority. Since joining the PA House, Morgan has introduced laws to end nuisance stop and goes, reverse the trend of maternal mortality, expand financial relief for childcare expenses, and to bring dignity for incarcerated women. She currently sits on several committees in the PA House, including Appropriations, Health, Insurance, and Labor and Industry. She is a co-chair of the Women's Health Caucus and a member of the Pennsylvania Legislative Black Caucus, the Philadelphia Delegation, and the PA Safe Caucus. She also sits on the Housing Working Group and is an active member of the Police Reform Work Group. And we are pleased to have her today. And so, Representative Cephas, I give you the floor.
Thank you so much. Thank you for the introduction. I always cringe sometimes when we have to sit through the long bios, but I appreciate you getting it all in this morning. And as you know, they stated, I am State Representative Morgan Cephas, and I hail from the 192nd Legislative District, which, yes, is in Philadelphia, all the way on the other side of the state. So I am excited not to have to drive all the way out to you because it is extremely far. But I am happy to, really be joining you this morning virtually at this time. And, I first and foremost want to thank Healthy Start and the Black Women Policy Agenda for hosting this conversation and, really adapting to the climate and the time that we're in, but also continuing to push a conversation that we have been having, long before COVID-19. But before I go into my remarks, I especially want to thank my colleagues that are on the call. We can't wait to get you out to the city of Philadelphia virtually, but there's so many trailblazers coming out of Western PA, and to have their voice both at the state and the federal level, really makes all the difference. Oftentimes in the city of Philadelphia, we are constantly feeling like we're fighting the battle of being an urban city in a large commonwealth that is majority rural. But we know our brothers and sisters out in Western PA join us with so many fights, from maternal health to economic justice, workplace justice, and again, not just from the state of Pennsylvania, but all the way to our White House. So again, I want to thank Congressman Doyle for joining this conversation, having the courage to join a conversation about Black maternal health, as well as our chairman from our health committee, Dan Frankel. I saw my colleague, Representative Ed Gainey, Rep. Wheatley, Rep. Sarah Anamarato, Rep. Summer Lee. I want to say I saw Chairman Dan Miller, but wasn't sure if D. Miller was him. But, I, again, am constantly thankful to have our partners and our colleagues out from Western PA, really joining us in Philadelphia to fight, again, policy issues that, can be particularly challenging because, our voices are representing an urban area. I had an opportunity some years back when I first started as a legislator in 2017 to actually come out to Pittsburgh. Mind you, again, this was pre-pandemic, pre-mask, this new virtual world. And during that conversation, I was asked to keynote. And this was, before I, started taking a deeper dive into health policy. I came to Harrisburg thinking that I was going to, focus on, economic development and building neighborhood commercial corridors, pumping dollars in the recreation centers. I mean, you come to the table thinking that you're going to be laser focused on the issues that you ran on. But, once you get up here and you find out where there are gaps, where there are holes, and what challenges are actually facing your community, you are, constantly forced to pivot. So when I came out to Pittsburgh again to give a keynote address, we were talking about health equity and, really what that meant. And mind you, again, this was in 2017, not in 2021. And, organizations, like Healthy Start and the Black Women Policy Agenda, we're talking about what does equity mean in a country like the United States, especially in the Commonwealth of Pennsylvania. I mean, when we're talking about health equity, it's more than just access. It's more than affordability. It's more than, quality as it relates to healthcare, but it also is about the social determinants of health. We can't begin to talk about access and equity unless we're talking about the things that impact our lives lives and our ability to live a healthy life on a day-to-day basis. So, when we're talking about the intersection of our health, intersection with issues like environmental justice, with the lack of clean drinking water, challenges with clean air. I know here in the city of Philadelphia, we are constantly talking about the issues of lead and asbestos, not just in our school buildings, but in our drinking water, in our housing infrastructure. We are a very old city where significant areas across the city have environmental justice challenges, and we have large companies sometimes coming in, not truly concerned about the impact that they are going to make, the detrimental impact that they're going to make on Black and Brown communities. So again, when we're talking about health equity and we're looking at those social determinants, we're also talking about workplace and economic justice. You can't A family can't begin to think about access to healthcare if they're living in poverty, if they're not making fair wages. And when we're talking about Black and Brown women, we're not talking about that 89 cents on the dollar or even that 70 cents on the dollar. We're talking that 56 cents on the dollar. We're talking that 44 cents on the dollar. So if we're not putting people in a place where they have economic opportunity to maintain a quality of life, inevitably, their access and affordability to healthcare is going to be challenging. And, there was a comment made that really put it in a great perspective. And it essentially is that your zip code should only determine where you live, not specifically how long you live. And here in the city of Philadelphia, and I'm just going to keep referencing it because, it truly is my life experience. I represent a district that sits across the street from a county, one of the wealthiest counties in the Commonwealth of Pennsylvania, where there is a 10-year life expectancy difference just by walking across the street. And again, this is pre-pandemic that I'm talking about. This is 2017. This is all of the things that have collided as a result of the mismanagement of this virus in the White House. But we'll get into that later. So, as it relates to health equity, I had an opportunity to sit down with our Senator Bob Casey some time ago when he was running for re-election. And we were having a roundtable discussion with a group of Black women out in Philadelphia. And the question came up, what is the Commonwealth doing around maternal mortality? And, at that point in time, again, I'll never be a politician that says I know all things. So at that table, I completely had a blank stare. I had no clue what was being discussed around maternal mortality. And this was the time when the Time magazine article came out. Serena Williams was doing her expose. Beyonce Knowles came out to talk about her challenges. And, so I took an opportunity to really dig a little deeper. And I know in the opening remarks, we talked about that there's close to 700 deaths per year. And mind you, again, this is data pre-COVID-19. I'm going to keep on saying that because for some reason, policymakers are not us, but policymakers are just now waking up to what true health equity means and what lack of access means and how detrimental that can be to communities as a result of the pandemic. But again, pre-pandemic, we had the close to 700 deaths per year. And just to ground everybody in the issue of maternal mortality, this is when a pregnant person loses their life either during pregnancy or up to a year postpartum. And we know when the country catches a cold, Black and Brown communities catch pneumonia. So naturally, as it relates to maternal mortality, as it relates to infant mortality, Black and Brown women are 3 times as higher to lose their life due to pregnancy challenges compared to their white peers. Additionally, digging a little deeper, the question that oftentimes comes up, well, why are Black women losing their lives? Is it because of economics? Is it because of poverty? Is it because of education? And, I, again, will always acknowledge Serena Williams as well as Beyonce Knowles, who have the best healthcare any of us could ever even think of or even access. And the fact that they had challenges during her pregnancy really speaks to not just the conditions of Black women, but it also speaks to the perspective and perception of Black bodies not being listened to, the myth that Black bodies can take more, are at a higher pain threshold than others. And it really speaks to the racism, the structural racism that exists across our healthcare system, but not just race, the sexism. So when you intersect race and gender, you just created tsunami in this country of just discrimination. And, that's the true conversation we need to be having as we talk about health equity. Another important point to mention is that when we're talking about maternal mortality, it's important to understand when are we losing the most lives. And according to a CDC report, we lose the most lives during the postpartum period, which is roughly around 51%. And it's important to, understand this data. This is United States data. This is statewide data. But it's also important to dig a little deeper and understand what's happening in the Commonwealth of Pennsylvania. Because again, as you all are well aware that what's happening in PA might not be happening in California. And it's important to make that distinction, because what we need to do as fixes here in Pennsylvania, again, might not look like what it looks like in other places. Thankfully, when we were asked the question, what's happening in the maternal mortality space, we actually had our Republican colleague, Ryan McKenzie, and I always have to give him credit. He introduced and ushered legislation through to create a Pennsylvania Maternal Mortality Review Committee. And why that's important is that we need experts identifying, studying, and making recommendations as it relates to the maternal mortality issues here happening in the Commonwealth of Pennsylvania. So recently they came out with a report. And again, these are just a lot of legislative updates. It's a lot of stuff happening in this space. There was recently a report released not a month ago, like literally several weeks ago. So this conversation is extremely timely. And unfortunately, our data is going in the wrong direction. So the report was focused on numbers between 2013 and 2018. And unfortunately, we have seen a 21.4% increase in pregnancy-associated deaths. And again, as you can imagine, Black and Brown communities, Black and Brown birthing people are disproportionately impacted, where Blacks account for 23% of pregnancy-associated deaths in PA, but only 14% of the births. I'll repeat that. 23% of pregnancy-associated deaths in PA amongst Blacks. That's what it represents. 23% of Blacks lost their life based on pregnancy associated deaths, and only 14% of the births, which is a travesty. One of the other bullet points that was recognized that in 2018, 30% of the deaths, maternal mortality deaths, were based on accidental poisoning, which includes drug overdoses. And 53% of the cases were paid by Medicaid. So that's what it looks like across the Commonwealth of Pennsylvania. Again, Black and Brown birthing people are dying at a higher rate here in our Commonwealth. And it's important to understand what's happening here in our home base so we can tell our own story. The other piece that was extremely startling, the city of Philadelphia established its own maternal mortality review committee. And this is something I would definitely recommend to be created out in the Pittsburgh community, because the report that was mind you, we need to read a lot of reports. Because we have to understand the dynamics of the issue. And I understand that Pittsburgh in 2019 released an inequality across gender race report. And what was founded was that Black women's maternal mortality is higher in Pittsburgh than 97% of similar cities. So that means Black birthing people in Pittsburgh have their challenges, significant challenges, similar to the city of Philadelphia. We are releasing an updated report for 2013 to 2018 as well in the next coming months. And again, similar to the state, our numbers do not look good. But luckily, This has become a national conversation. It was a national conversation during the presidential election. It resulted in the last administration providing significant levels of funding to states to support their maternal mortality review committees. So here in Pennsylvania, we were awarded $2.5 million through the CDC. Additionally, in the city of Philadelphia, we were awarded $1 million for the Merck for Mothers grant from the Merck pharmaceutical company. So there's significant dollars being invested in this space. But here in my legislative district, which again also opened my eyes up to what was really happening, was I had a constituent, Latasha Gilmore. She was 34 years old at the time. This happened in 2018. Again, when a lot of this conversation is bubbling up around addressing maternal mortality. She was 34 at the time. She had a little boy, and she unfortunately lost her life while giving birth. And what that represented was a rude awakening that, we can read as many reports as we want. We can talk about as much data as we want. But until we listen to Black and Brown birthing people about their lived experiences, then we are never going to get this issue right. And it's important to do that. So not only do I applaud this organization for including, yes, policymakers and legislators, but we also have to continue to include those that are boots on the ground. So those doulas that are taking care of our birthing people, those midwives, community-based healthcare workers. We have to include birthing people in these conversations. So again, they can tell their lived experience from a firsthand perspective and give us what we need to do as legislators. Because at the end of the day, we work for them. But fast forward to COVID-19. Again, mind you, all of this is happening pre-COVID-19. We were going in the wrong direction. 21% increase in maternal mortality deaths in Pennsylvania pre-COVID. When you add a pandemic, again, I go back to the comment, when the nation catches a cold, Black and Brown communities are catching pneumonia. And what COVID-19 has just added was increased isolation for birthing people, which naturally could potentially lead to an increase in postpartum depression. And remember that statistic, 51% of maternal mortality deaths are happening during the postpartum period. So add a pandemic in that isolation, but then also add in the idea of someone, in the process of bringing life into this world, having to navigate our vaccine and a testing system. Literally, I was just having a conversation of the inability to navigate the system as someone, that doesn't have children. Imagine someone bringing life into this world, having to navigate a system where at the beginning they had been discriminated against. Because as you know, birthing people and postpartum people were not included in any clinical trials. So, you have that even growing concern of being able to take the vaccine without having any data as to what the effect and what the impact is. And we've also learned that birthing people while pregnant, but also during the postpartum period, are not at higher risk of dying, but are at higher risk of having extreme cases of COVID-19, which is extremely alarming. And last but not least, having to revisit your birthing plan. Imagine not being able to have all of the support that you needed while you were in the hospital bed, which was a policy that was put in place in Pennsylvania where you only could have one person. So you're choosing between your birthing partner or your doula or your midwife that is there to help you advocate for yourself. Imagine having to choose between those two people. Additionally, having to conform to telehealth appointments. I luckily was able to, watch my younger sister bring life into this world during COVID-19, but watching her struggle and watching so many other birthing people struggle with navigating a telehealth system. I mean, when we're talking about the digital divide in so many communities, Philadelphia to Pittsburgh to rural counties, just when it comes to accessing digital learning, imagine what individuals are going through as they're trying to get proper care during this time that is supposed to be so sacred and so precious. And lastly, the financial impact of the pandemic. There was a statistic from the National Women's Law Project where 2.2 million women had to leave the workplace because of the added pressures at home. So imagine unemployment, imagine testing, the vaccination, isolation, all of that added to with the pandemic, added to the statistics that I just talked about that we're still going in the wrong direction. Now, I know I'm painting a bleak picture, but this is the reality on the ground. And, I truly believe that we're in a unique time right now. As elected officials, we are unfortunately not able to see the glass half full. We always have to look at it as the glass half empty, half full. And, we have to look at new opportunities. And right now we are in a crisis, but we have significant leadership, a significant change in leadership across so many of our legislative systems, from the White House, as you know, with President Joe Biden and Vice President Kamala Harris, who we know was a leader while in the Senate on maternal health issues with the Omnibus bill. So we know we have an advocate in the White House. Additionally, the new Pennsylvania physician general, who is a Black woman, but also an OBGYN. So she comes with her own lived professional experience on maternal health, especially coming from a woman of color. Additionally, I always got to give my colleagues out west a shout out. We have new leadership with our health committee with Chairman Dan Frankel. And, again, so many dynamic leaders and voices coming out of Western PA. We also have new leadership in our Women's Health Caucus. If you didn't know, our chairman, Dan Frankel from the Health Committee. He was the originator of the Women's Health Caucus, and we will be forever grateful for him leading that body of work for a period of time, and helping to transition the work over to 4 new dynamic women, including myself, Representative Mary Jo Deely, Senator Judy Swank, and Senator Amanda Capoletti, where we've really crafted out a bold agenda moving forward. Again, as we are in this crisis, we need to really ask ourselves, what does health equity truly look like? What are the goals that we are outlining that we can truly achieve as we move forward through this crisis? As we come out of this, we absolutely have to see a new environment, a new energy, a new focus on ensuring that Black and brown bodies are not dying. We are worse than some third world countries, which is beyond me. There is no way in the city of Philadelphia, where we have the University of Penn, Temple University, Jefferson Hospital, that we have the rates that we have, but similar also to Pittsburgh, when you have Carnegie, when you have Pittsburgh University, so many phenomenal institutions. We should really be able to wrap our arms around this and move in a different direction. So with the Women's Health Caucus, we will be focusing on 4 specific areas. One, of course, including maternal health and childcare. Again, that's maternal mortality. That's also expanding the maternal healthcare workforce. So that means certifying doulas. That means certifying certified midwives and expanding the workforce footprint so it expands access points. Additionally, ensuring that there's postpartum coverage, as well as affordable childcare. We're also going to be working on, again, we have to have a holistic agenda in order to tackle this, because you can't just talk about health equity without talking about the social determinants of health and how you're going to tackle each. So we're going to be focusing on workplace and economic justice. That's workplace accommodations for birthing people, sexual harassment and discrimination. And let's not forget equal pay, fair wages, and paid leave. We'll also be focusing on dignity for incarcerated women. We all know that there is an intersection between birthing people and individuals that are incarcerated. We have to ensure our shackling laws are up to date, not just on a state level, but also in our county facilities. facilities. Additionally, we have to ensure that our staff is trained in trauma-informed care. You have individuals that are going into prisons that have a high rate of mental health challenges. They are heads of households. A significant number has experienced sexual assault. So we have to have individuals that are mindful of it being difficult, not just being incarcerated, but leaving their families. Of course, also access to feminine hygiene products. Right now, it is a policy, not necessarily law. So if we lose our secretary, they can completely go into a different direction. So we have to ensure that we firm that up. And last but not least is just access to healthcare. Again, expanding reproductive healthcare access and coverage, addressing clinical practices, patient autonomy, menstrual equity. So, especially last but not least, access to telehealth. We really have to figure out this footprint again, not just when it comes to doctor's visits, but also when it comes to monitoring patients once they leave the hospital bed. Because again, during that postpartum period is when we lose a good majority of our birthing people. So, needless to say, we have a bold agenda. Of course, we will be constantly on defense, where for some reason our colleagues on the other side think when we talk about maternal health, we only mean access to abortion care. There are a lot more other things happening in an individual's life outside of that one moment in time and that very delicate decision. So we will be on defense, but we do have a bold agenda that we really want to push forward, and we do believe we can do that now, given all that's happened. Now, some of the bills that have been introduced around maternal mortality, and an interesting thing, again, you do see a lot more of our Republican colleagues introducing legislation around this area. So again, we have bills that would expand Medicaid up to a year postpartum. We know right now individuals are on Medicaid as we speak and cannot be removed. I find it always interesting that government can find ways to pay for things when we're in a crisis. So regardless of where you are for Medicaid for all, the fact that we are essentially piecemealing and paying for Medicaid for everyone right now is very interesting during a crisis. Additionally, regardless of where you are for getting monthly payments from the government for constituents, some way we found an extra $1,400 to give individuals. So it's like we can do bold policy agendas when we're in crisis. Again, we just have to figure out how do we get things done and keep these safety nets in place post-pandemic, and that is going to be the fight moving forward. So additionally, we're introducing legislation to require reimbursements again for doula care, as well as certifying doulas, but also paying them at an equitable rate. Additionally, that applies to certified midwives as well. We're also going to be talking about implicit bias training for medical and other healthcare professionals. As I mentioned at the top of my remarks, that racism within this healthcare structure definitely plays a critical role in the treatment of birthing people throughout their entire process. Additionally, we need to add screening and support for birthing people during the postpartum period, not just the identification of postpartum, but also connecting them to mental health resources that are tailored and focused on postpartum treatment. Now, you can't just go to a regular therapist or a mental health professional that doesn't have an expertise in that. And we have to ensure that individuals have access to them in a way that allows them not to have to travel a significant amount of time in order to get there. So we have to make them readily available. Additionally, there's been an interest in providing insurance for fertility treatments. And of course, there is parental leave as well as dignity for pregnant and postpartum people. So again, we have a significant agenda ahead of us, but there's also light at the end of the tunnel. Just recently, within the American Rescue Plan, there was a piece that was included that would extend Medicaid coverage for pregnant people up to a year postpartum as a part of a state plan amendment versus states having to go after a waiver. So if we know, again, that we're losing the majority of our birthing people during during the postpartum period, we need to ensure that they stay connected to healthcare during their entire time. And that is even, once we get out of this pandemic. So there is, again, light at the end of the tunnel. Thankful to Congressman Doyle for his role in passing a $1.9 trillion package. Now we just have to make sure that the dollars that come to the Commonwealth of Pennsylvania are used in a way that, again, back to my earlier point, really creates the health equity that we constantly talk about, the health equity that allows individuals to, live a quality of life that addresses all of their healthcare needs, but doesn't just allow them to strive, but really makes them be able to thrive in their communities. And that's going to take these type of conversations. That's going to take your continued advocacy. That's going to take lived experiences, stories, letting your legislators know what it's like to be on the ground versus in a policy world versus in an article and versus, as a statistic. So we do have our work cut out for us. And again, I'll close on a happy note, in my opinion. Even though we are in this crisis, we will see our way through this, but we really need to use this opportunity to move a policy agenda as it relates to maternal health that really will tackle these issues, because we should not, 3 years from now, when the next report is issued from the Maternal Mortality Review Committee, talking about the same challenges, talking about the same gaps in our healthcare system, and talking about legislation that hasn't moved either on the federal level or the state level. So I thank you again for allowing me to constantly be a part of this conversation, for allowing me to take the trip over into Pittsburgh virtually. And, I really look forward to today's conversation and to the continued advocacy work of both groups. So thank you so much.
Thank you so much for your poignant words, Representative Cephas, and for your leadership in Harrisburg on behalf of, all Black mamas and babies. So now I have the pleasure of introducing a mama. Ms. Faith Otey Emanuel is going to share with us about her experience, her birth experience. And so we want to welcome Ms. Faith. The floor is yours.
Hello, my name is Faith once again, and I want to thank you for having me. I hope my story gives a clearer lens by which to see how callous doctors' hearts can be toward Black women in the most vulnerable medical moments. I was 38, married 4 years when I had my first child. I had an uneventful pregnancy, no abnormalities with my health. I did have high blood pressure, but that was controlled the whole pregnancy. I had a cesarean with no problems. 8 days postpartum, I'm back in the hospital with fluid in my lungs and congestive heart failure. My physician was young and very svelte, and he blamed me for being fat, and that was his choice of words. And that was the reason I was sick. And I told him I had a history of polycystic ovarian syndrome, which causes women to have horrible weight issues they can't control, among other hormonally charged health abnormalities. And he still blamed me for being fat, and for that weight issue being the cause of my my heart failure. And the whole problem was he never was able to properly diagnose me. All he said was I had congestive heart failure, but there were no details, no explanation of what kind. He never could tell me what was wrong with me. The cardiologist that I dealt with, she also blamed me for being fat. And she too could not explain to me what was wrong with me. So I left that hospital not really knowing what was wrong, but it was my fault. Many medical professionals are devoid of empathy and compassion toward us, and it seeps through in their body language, tone of voice, and level of care offered. And this is just one of the outrageous experiences I've had in the hospital. 2 years later, I was pregnant again with my son, and the medical team that I was dealing with at that time, they felt that I received negligent care because nothing that they had made sense. They didn't understand why I was being blamed for congestive heart failure. They said a lot of people are not fat who have congestive heart failure, and they just were kind of appalled by my experience. Thank you.
Thank you so much, Faith. Your willingness to share with us today is amazing. And we are so sorry you had that experience, but we're all here today to make sure that mothers like you no longer have those experiences. So now I have the pleasure of introducing our moderator for today's panel discussion, Ms. Jada Sherrill. And Jada, as stated earlier, is the Chief Executive Officer of Healthy Start Incorporated and the owner of J. Sherrill Consulting. In her 3 years in leadership at Healthy Start, Jada has deepened the organization's focus and impact on community level advocacy, systems level coordination, and elevating the voices of women served. In her role at Healthy Start and in related community work, Jada strives to ensure that health equity remains at the forefront of all conversations. The floor is yours, Ms. Jada.
Thank you, Rochelle. Good morning, everyone. It's actually been 4 years at Healthy Start. It's been a whirlwind, but it's been a wonderful experience doing really important work. Thank you so much, Representative Cephas, for setting the tone to help us understand how complex and intersectional this work is. And at a time when life should be so beautiful, we're giving life. There are so many complex issues. There are so many challenges, both from a global and policy perspective to the individual level. Thank you, Faith, for your bravery and sharing your experience and being here to continue to advocate for women and advocate for Healthy Start so that our voices are heard. I am really excited to moderate the upcoming panel as well as the one that we have for you a little bit later. So without further ado, I want to quickly introduce our panelists and give them all a minute to make some remarks, and then we have some questions. There are questions being posed in the chat and the Q&A, and we will get to those questions closer to the end of our session. Just wanted to make everyone aware of that. So our panelists are Representative Frankel, Representative Lee, Congressman Doyle, and Jamelia Please. And I'm actually going to start with Congressman Doyle. I know that you have some time constraints. So will each of you please give a minute of remarks, and then we will go into a couple of questions. Thank you.
Well, first of all, let me thank the organizations that have put this together, the people that are watching. I want to send greetings to my friends and colleagues in the state legislature. Rep. Cephas, thank you for your words, and Faith, thank you for sharing with us. As you know, Congress just recently passed a $1.9 trillion bill that is very comprehensive and has many provisions in that bill that are going to help us deal with some of the issues that we've discussed today. Over $7 billion going to the state of Pennsylvania, much of it discretionary, should help the state also with some of the programs they're doing. And then also I'm a member of the Black Maternal Health Caucus and a proud original co-sponsor of HR 959, the Black Maternal Health Momnibus. And maybe during the Q&A, I'll dive into that a little bit more, but I'm happy to be here. I apologize that originally when this was scheduled, we weren't scheduled to be in Washington this week, but our schedule got changed. And so I'm down here in Washington, and they're supposed to call us to the floor for the votes a little after 10 o'clock. So I hope to be able to spend as much time as possible with you before I have to leave. And with that, I'll look forward to the questions.
Thank you. Okay, next we'll hear from Representative Frankel. I'm just going in the order that I see you all on the screen. Thank you.
Well, thank you very much. And I want to thank everybody who's organized this today and my colleagues as well. I think one of the things that's clear, and Representative Cephas has certainly been critical in terms of elevating these issues in the General Assembly and across the state. I'm very grateful for her work. She's now part of the Health Committee, which I am the ranking member on. And she's just been almost a revolutionary figure within the General Assembly in creating some bipartisan desire to address these issues. I will say that during this pandemic has basically lifted the Pandora's box, the lid off the Pandora's box, and exposed disparities in healthcare, particularly with respect to Black and brown women and maternal health care issues. This has just been a complete disaster, but we knew it was there before. It has only it has only become more visible and more painful, I think, during this very difficult time. We have efforts in the legislature that we can talk about later in terms of address this. Representative Cephas has been a leader on that. She talked about a number of those issues, and we also know that many of my colleagues who are also on this program today, Representative Lee, Representative Gainey, have been important voices and have their own initiatives with respect to how we can address these disparities, and particularly dealing with maternal health. So let me turn it over to them, and thank you.
Thank you, Representative Lee.
Morning, Jada, and good morning, everybody. It's so nice to be here with you today. Even if I yawn a couple times, please ignore it. It is not you, it's me. But I thank you all so much to the organizers of this event, and not just this event, but really the folks who have been on the vanguard of Black maternal mortality, and in Pittsburgh specifically, in leading the work and the effort to make this city livable for everyone. And I think my colleague Cephas said what needed to be said, and pointed out so many all of us to move. And I can say that I am new to Health Committee. I am new even to this work. While this isn't my expertise, it's something that's impacted me personally. Having had a friend and losing a friend in childbirth, and it's unspeakable, and it's something that affects me. And I know as a Black woman, it's something that I think about. So I'm honored to be here with you today, talking about solutions, talking about this issue, and spreading the word until we fix this. So thank you so much.
Thank you. And last but not least, Ms. Please.
Thank you, Jada, and thank you, Rochelle, for inviting me to speak on this panel. And so just a little bit about me is that I have over 10 years experience of labor and delivery. And I think that's unique because I've worked during this pandemic and I've witnessed the inequalities, the implicit biases, the systemic racism firsthand, and how it affects maternal health outcomes. And Faith, I just want to say thank you for sharing your story candidly, because I think this is how we change the narrative and move the needle in the right direction, by giving women a voice, because that is the common theme in most highlighted maternal deaths that made like public news. There's a failure to listen, where Black women are feeling that they're not being heard. If we look at, I don't know if you're familiar with the Amber Isaac or the Kira Johnson story. I know that Charles Johnson is a big advocate and a part of the Monuments Act. There was a failure to listen. She had a postpartum complication. She was ignored, like a CT scan was ordered. It took 12 hours before they realized that she had was basically hemorrhaging on the inside. And unfortunately, she lost her life prematurely. So again, I think having this candid conversation and sharing stories, and this brings awareness, and then awareness can bring action. So today, my goal is to bring real life to those stories, what it's really like at the bedside. Because again, being a nurse, I can recall my first maternal death. It's something you remember. And when you're a nurse, you spend 12 hours with a patient, more in-person time than anyone else on the healthcare team. And it changes you, and you begin to see the disparities, and you begin to take action. And that's how my organization was formed, because we can no longer sit on the sidelines. Listening to the keynote, 2 women per day die in the United States. That's 700 women per year, when 60% of all maternal deaths are preventable. We're failing. So I'm excited about the Monuments Act. I'm excited about this conversation. I'm excited for collaboration and being a part of the change.
Thank you. So let's start with talking about the pandemic, because it is, it's so relevant, and it is right in our faces. We don't know what what life is going to look like a year from now. We don't know what healthcare is going to look like a year from now. We don't know how the pandemic and the virus may affect pregnant women because there wasn't testing there. So starting with the pandemic is very, very real and near. And we know that it has really brought to the forefront the inequities in health that affect Black and Brown people. So can we talk a little bit more about legislation? The omnibus was mentioned several times as a holistic policy level way of addressing infant and maternal mortality and a host of other issues around healthcare and health equity. Let's start with what legislation is in place that can address some of these inequities related to what we see currently and what we may see further down the road related to the pandemic. Let's start with you, please, Congressman Doyle, and you're on mute.
Thank you. Yeah, I'm happy to tell you what we're working on down here in the federal government. The Black Maternal Health Omnibus is a comprehensive piece of legislation, and it has a few major titles and goals. But some of the major titles that we're addressing is the social determinants of maternal health. We want to address racism and bias in maternal health outcomes, build a more diverse perinatal workforce. We have to improve our data collection, address maternal mental health, improve maternal health services for incarcerated women and active duty military and veterans, improve telehealth and technology access for moms, and incorporate that into the maternal health practice and address maternal health related to the pandemic. This is probably the most comprehensive healthcare legislation that's been introduced in Congress for quite some time. And I think there's a real desire among members of both parties to address these disparities. Right now, this bill is a democratically led effort that we're hoping to get some of our colleagues on the Republican side to join. Another important thing is we're expanding Medicaid to a year postpartum. It's currently 2 months, and we finally got this done in the American Rescue Plan. And we think that that can help make a big difference for low-income women. We established a new option for states to extend postpartum coverage to new mothers for 12 months. Current law only allows 60 days. This bill authorizes $1.131 billion over 5 years. And this is a 5-year authorization, but we expect that we're going to be able to make this permanent, or at least extend it every 5 years like we do with other public health extenders like the Community Health Center funding or Ryan White HIV/AIDS funding. This bill sits in the Energy and Commerce Committee. It has some other referrals, but it sits in the committee that I serve on. It's in the Healthcare Subcommittee. I'm not a member of that subcommittee, but we hope to move this later in the year. Right now, as you know, we were dealing with the American Rescue Plan. We're going to be dealing with a rather comprehensive and ambitious infrastructure bill to get this country moving again economically. But this is clearly on our agenda in the Energy and Commerce Committee, and we hope to move this legislation out of committee this year.
Thank you. Does anyone else from the panel want to address that question?
Hi, so I am really hopeful and excited about the omnibus bill because this is the first bill it's very comprehensive. There's actually 12 bills within this package, and this is the first thing that I've been made aware of anything of this sort to specifically address Black maternal health in this country. But one of the things I want to highlight with this bill is that they're going to implement a maternal health advocate. And I think that's very important. So this advocate would serve at the hospital and they're not directly a part of the medical team. So now moms will have a liaison, someone that they can speak to help, mediate, to help understand and bridge that gap. I think, again, working firsthand in labor and delivery for years, I think this is amazing because when the provider conflict arise or, when there's a conflict, whether or not the mom wants to agree and consent to a C-section, you have someone outside of the medical team that can advocate for the mom and ideally help us meet a happy medium to ensure healthy outcomes. But I just want to state, because I think it's very important to highlight that the Black maternal health morbidity crisis is not just a poor Black woman problem. Because according to the CDC, educated Black women are 5 to 6 times more likely to experience a pregnancy complication and even die from a pregnancy complication. So we highlighted Serena Williams. The backdrop story with Serena Williams, she was very aware of her health problems. She knew that she had an embolism. Had she not been persistent in speaking up, she wouldn't be here today. So I just want to paint that picture that, because sometimes, and I'm so sorry, Faith, again, it's like, oh, well, Black women are overweight. It's because they're fat, or it's because they're poor, or it's because they're on Medicaid. It's a bigger, more complex problem because the data doesn't lie. And the data shows that educated Black women are 5 to 6 times more likely to die from a pregnancy complication, such as our affluent Kira Johnson, who, again, is a part of why the Mom Unibus bill is really being, was introduced.
Thank you so
Yeah,
much.
if you'd like to get a little perspective of what we've got at the state, I know Representative Cephas did that, but I think we have an active agenda. Unfortunately, much of it is not bipartisan. There are some bipartisan efforts here, but many of these are Democratic legislative initiatives that include several bills that Representative Cephas has championed, including expanding Medicaid postpartum for 1 year, which currently expands it from what it is now at 2 months, requiring Medicaid coverage for doulas, improving data collection by adding severe maternal morbidity to the list of reportable events within the Department of Health, and require implicit bias training for healthcare providers. And another piece of legislation that I think does have some bipartisan support as well is Representative Bridget Kozarowski, who is a registered nurse in Newtard General Assembly, on a maternal home visiting program to allow families to receive personalized help from health, social service, and child development professionals. So there is a robust agenda. That's just a few of the things that we have there, but you go back to other issues that we've been working on for years that would address this, which include a $15 minimum wage, equal pay for equal work, to address the economic disparity issues that directly translate into issues for women, and particularly Black and brown women who are starting families or have families. So those are issues that have been longstanding, that we've been trying to address for years at the state level.
Thank you.
Yes.
Unless
you want to ask something totally different and move in a direction, I did want to say something, right? Because, and I know that even just preparing for this today, it's a reminder of how slow and piecemeal and kind of arduous the legislative process can be. And I think it's really good. I mean, just having brief with Morgan Cephas and talked about all of the bills that we've had. They've been mentioned by Congressman Doyle. They've been mentioned by Representative Frankel. But the reality is that when we're talking about social determinants of health, right, that's not something that you can necessarily legislate away, because very often, right, we can have all the best bills in the world. We can have legislation that is very meaningful, that says all the right words. But when we talk about implementation, when we talk about how do we address cultural issues and societal issues at once, the implementation is where it gets a bit harder. So when we're thinking about the social determinants of health, especially here in a place like Pittsburgh, we're talking about a place where we have environmental racism that's run rampant. We're talking about folks who, because of that environmental racism, were more likely to have comorbidities, or more likely to have asthma or COPD, or respiratory issues, or other things that contribute to our health. We're more likely to live in poverty, but also we know that poverty, when controlled for poverty, Black women are still dying. So we know that this is also racism and cultural. So while these pieces of legislation are important, right, we have to talk about how are we fundamentally changing society. And that's a deeper conversation that talks about the treatment of Black and brown folks in the education system, that talks about the treatment of white folks in the education system and how they learn about us and what they're experiencing when they're with us, right? And I wanted to lift that up, right? And I know that we're going to get more into that, but I did want to lift that up because legislation or sometimes can just be words on a paper. But when we're talking about a problem here of Black and brown mothering folks not being listened to, that also happens at the legislative process. And we can't ignore that. So I did want to lift that up.
Thank you so much. Thank you for all of your remarks on this first set of questions. So I wanted to segue into this next question. So we talked about Medicare expansion, which I think is wonderful, and it's definitely a great win for protecting Black maternal health and protecting maternal and child health for all folks who have Medicaid insurance. But we also know that income and education is not a protective factor for Black women, as was mentioned, and that's very important to highlight. So we can't have this conversation without absolutely talking about racism, whether it be environmental racism, systemic racism, all of that. So we know that provider biases occur with low-income individuals, and they adversely affect Black women and babies' health. We also know that in our last presidential administration, there were attempts to outlaw anti-racism work being conducted with federal funds. So where do we go from here in terms of, as Representative Lee said, it's hard to legislate morality. And in this work, a lot of times it's not about the data has spoken, the research has spoken, but at this point, it's about changing people's hearts and minds and right and wrong. So how do we begin to work at the policy level to make sure that, as Representative Cephas talked about earlier, that there is implicit bias training, and even taking that a step further, that there is anti-racism work done so that everyone can have quality of life across education, across the environment that they live in, health, all of those social determinants. So we'll start with you, Representative Lee. Thank you.
Yeah, well, I mean, because it does dovetail. I would say that the goal is, right, not what policies are we creating, right, to do something about implicit bias. Is what can we do in the interim? Because implicit bias and fixing implicit bias and addressing it is going to be a forever thing. It's going to be something that we are always having to adjust for, because that's just the nature of our society in the United States. But when we're thinking about what can we do to cover for, I think about stories that I've heard from doulas that I know. And one powerful one that I heard was this doula was with a birthing person who was an immigrant, and their family member didn't speak English, and they needed a translator. And the staff and the folks who were in delivery room were really kind of funny about this person having a translator on the phone so that her mama could basically be there with her through the process, and not having her mama and not being able to communicate with her was violence at that moment. It made her birthing process dangerous and worse, right? But that doula was there and that advocate was there to ensure that they didn't hang up on the translator so that the mom could continue to participate, right? When we think about the need to have folks like that, we're going back to just traditional practices that we've had in our society, midwifery and having doulas, but also making sure that we are able to get them and afford them. So we talked about making sure that we have Medicaid coverage for doulas, making sure that those doulas, Black doulas, are able to be certified, that they're able to be there in rooms with us, particularly through this pandemic, right, where we have more restrictions. We have to talk about what can we do in the interim. And those are definitely things, but I wanted to lift that up. But also when we're talking about racism and we're talking about that kind of structural problem, we have to talk about the prisons. Having gone to prisons, I've been there where we have a women's prison, Cambridge Springs, where there is one social worker for 1,400 people, where there are birthing folks giving birth and going through their birthing process in prison while in prison. Their babies are in the ICU, and the mothers are basically separated from them after a day. So we even have to talk about addressing racism in the ways that we treat women who have been convicted or accused of crimes, because it goes that far. So we also have policies for that, dignity for incarcerated women. So I just wanted to uplift that also. Hand it off.
Thank you.
So I would say that, we can talk about the legislation, and we have the Department of Human Services has released a health equity report. We have data. The data is indisputable, but data doesn't really move hearts and minds, as you noted. And I think one of the things that we need to see, and the things that I've seen that have been most effective, are people bringing their personal stories to the legislator and to legislators. I've seen it work repeatedly in other areas where, in particular, women bring their stories, and they do change hearts and minds. So we can create the legislation. We have it, and we have Representative Cephas's implicit bias training legislation for healthcare providers that would certainly go to address this issue. But in order to get it done, we need to make sure that people understand why it needs to be done. And we need to hear those stories and the advocacy that really moves people in a way that data, pure data, just doesn't get the job done. So it's combining the data, combining the advocacy and the personal approach and stories that will help get some of these things over the finish line in a very difficult environment that we work in, that is oftentimes an uphill battle, and we're playing defense as opposed to playing offense, trying to get these progressive measures into law. So.
Yeah, I would just add that, and I agree with everything that's been said. Actually, the first section of the Omnibus bill, and this is a compilation of many bills, but I think it's, the first section is specifically aimed at improving social determinants for moms. We provide money like grant programs to funding local community-based organizations and local health departments to address social determinants of health. A task force to develop strategies to start to address these social determinants of maternal health. A Housing for Moms grant program to increase funding and access for stable housing. We expand WIC eligibility and create a grant program to expand initiatives for healthy food and infant formula and diapers and more to women who are living in food deserts. And also efforts to understand and improve the environmental conditions that Summers talked about, childcare access, transportation barriers. There's so much to be done, but it's a real focus of the bill. And there's another bill that we had in the 116th Congress, HR 4004, which was the Social Determinants Accelerator, which actually creates a social determinants council and provides CMS grants to improve coordination between health and social service agencies. But obviously, this is Title I of the Omnibus bill, and I think it was there intentionally to stress how important it is that we address these social determinants before we can move forward in other areas. So hopefully this is something that we can get off the paper of a legislative bill and get into practice. And I would also say that the money that's coming to Pennsylvania, as I stated before, over $7 billion. Much of that is discretionary types of monies, and hopefully will provide our colleagues in the state legislature some resources too to develop some of these programs at the state level or down more at as they maybe put grants down to the county level. I apologize, we're being called to the floor. So I'm going to have to leave you at this point, but if there's any questions for me, please get them. I believe Kate Worley from my staff is on this call also as a listener, and she will take down any questions you have for us, and we will get information back to you. But I very much appreciate being asked to be a part of this panel. And know that we're very committed down here in Washington, D.C. in this new administration. I can tell you, sitting through the last 4 years and sitting through the first 60 days of this administration, it's been a sea change and gives me hope that we can get some of this done. But thank you once again, and Kate will certainly advance any questions you have, and we will be happy to respond to you. So thank you.
Thank you so much, Congressman Doyle. At this time, in order to keep time and so that we can continue this dynamic conversation with other folks, we are going to transition. Thank you so much, Representative Frankel, Lee, and Ms. Please. Thank you for your work on behalf of our community and on behalf of the women and children that we serve. And hopefully you can stay with us and continue in the conversation. So we're going to transition to two additional personal testimonials. As was mentioned, the data doesn't lie. We have all the data and the research that we need, but it's really important to continue to hear the voices of women who have been impacted and find empowerment in those voices. So I'm going to introduce Sharissa Spencer. She is a past Healthy Start participant and a Queen Watkins Wise. Sharissa?
Hello, thank you all for having me and allowing me to tell my birth story. My birth story was one of the most incredible, with my first, it was one of the most incredible experiences of my life. I was able to have an all-natural and holistic home birth. Due to my son arriving faster than I expected, I caught him upon his arrival. The midwife was an African-American woman from Mississippi. She couldn't make it in time. So my contractions started about 10:30 that morning. My story is more, I guess you would say, a positive story. On April the 16th, I was not expecting my baby that day during my pregnancy. I educated myself on everything there was. However, education and experience was entirely different. By it being my first pregnancy, I wasn't exactly sure how labor would go because having a baby doesn't always go as planned. So all that day, I visited family and ran a few errands. However, I was unaware I was in active labor. I informed my midwife, and everything was occurring and decided to go. And go home and take a shower. Then I began setting up my birth space. After my shower, my contractions went from 9 minutes apart to 4 minutes apart. I called my midwife and gave her the update, and she began to travel to my home. My midwife was about 2 hours, which was the same amount of time I started my transitioning stages. She arrived 10 minutes after my son was born. What Black Moms Matters to me means, it means no matter what, we deserve to be heard. Our voices deserve to be elevated above what our bodies need and don't need. We should not be forced to make decisions against what our bodies are naturally made to do. During my birth experience with my midwife, she listened to my birth plan and how I wanted my birth to be. If she brought information to my attention regarding my pregnancy, she wouldn't tell me it was something I had to do. She ensured to educate me and allow me to make the best choice for myself and my body. Therefore, she had gained my trust, so I felt comfortable with most of the information she brought to my attention because she always had my best interest in mind. After my midwife gave her advice, she educated me. She never tried to influence my thoughts to only project her reasoning. She respected me as a woman and soon to be mother to make my decisions still and treated my pregnancy as a natural thing and not a medical procedure. I was treated like the woman I was created to be, a patient and a friend. And through the process, she began to feel like part of my family. Currently, I am in my second pregnancy and plan to have another home birth. Due to my recent move to Pittsburgh, I chose the hospital to do my prenatal visits due to not finding a trusting midwife in such a small amount of time. And of course, the experiences are different. My prenatal visits also bring me fear of ever having a hospital birth. And after researching the childbirth mortality rate in African American women. So when it comes to why Black moms matter, we matter because we deserve to be heard when it comes to our bodies, despite the color of our skin, our financial background, and having a doctor thinking we have a lack of knowledge about our bodies.
Thank you so much, Sharissa, for sharing that, and good luck in this second pregnancy. And thank you for sharing your little one with us.
Yeah, not cooperating very well.
No, that's okay. It's great. At this time, we would like to hear from Queen Watkins Wise.
Peace, everybody. My name is Queen Watkins Wise. I'm the Chief Advocating Officer at Whirly Fit LLC, Healthy Start CHA, and mother of 3 young children with a 4th on the way. Each of my deliveries have been with their own complications, in spite of me being a healthy woman prior to pregnancy and delivery. Most traumatic, however, was the birth of my 2nd child. As a mother, I have felt unheard and unseen during my most vulnerable time when I was giving birth, which should never be the case. This was a very unexpected experience for me because I've always had great prenatal care with my previous midwives, but it seems as when delivering and interacting, like coming out of that little suite of the midwives and going up into the hospital and dealing with, the rest of the hospital staff, I didn't receive that same compassion and care that I'd received with my midwives. I've been told things very similar to Miss Faith, that, I was always interested in having a natural unassisted birth. All of my birthing plans were ignored. I was told that I would never have a VBAC, vaginal birth after cesarean, due to both my race and my weight, my size, that I am overweight, and because being a Black woman, that being overweight and being Black meant that I didn't have any chance at having a VBAC, which just doesn't make sense to me. In addition to my birthing plan being ignored on multiple aspects, nurses have physically turned their backs to myself and my support system when we've asked questions while in labor, and even had a doctor ask me if I would be having my tubes tied during a cesarean, as it was my 3rd child, and he couldn't fathom that I would want any more than 3 children. Obviously, he's wrong. Baby number 4 right here. I've oftentimes wondered why these were my experiences. Does my race play a role? My insurance? Whether or not my husband was in the room? Are they assuming my marital status? There have been times during my deliveries where I felt I had to, puff up my chest and really exert, become very aggressive to exert what I needed and what I wanted, which should never happen during labor and delivery. And these things shouldn't play a role in our deliveries, but in my thoughts and reflections afterwards, I can't help but to think that they do. Birthing parents deserve equitable treatment, period. No matter what you look like, no matter what our insurance is, no matter what assumptions you have about our educational status, our marital status, any of those things. This is one of the most vulnerable times and one of the most vulnerable spaces that we can be in. We deserve support, period. Thank you for listening.
Thank you so much, Queen, and good luck with baby number 4. Can't wait to meet him. So at this time, we're going to transition to our second set of panelists, our second set of legislators. So we are reintroducing Representative Cephas onto this panel, as well as Representative Gainey, Wheatley, and Inamorado. So thank you so much for, maybe Representative Inamorado is not able to join us, but nonetheless, thank you so much for joining us on this second panel. We had a really good discussion on our first panel, and I wanted to give you all an opportunity to introduce yourselves and make remarks. For the sake of time, since we had you as our keynote, Representative Cephas, we will just skip that part for you and then go right ahead into our questions. So Representative Gainey, if you want to give us a minute or so of remarks, and then we'll and then we will go over to Representative Wheatley and get into our questions. Thank you.
Okay, hey, real quick. First, good morning, Jada. Good morning, Rochelle. Thank both of your organizations for holding this. Rep. Cephas, always a pleasure to see you and hear you. This is a big this is a big issue. We had a town hall on it last year, thanks to Jada and Gateway. We had a great conversation and look forward to answering any questions that I can answer. And I'm gonna keep it short.
Thank you. Representative Wheatley?
Yes, well, good morning, everyone. I appreciate being a part of this very significant and educational program this morning. Thank you, Rep. Cephas, for your wonderful knowledge and presentation. And listen, as a father of 3 and going through the birthing process with my significant other, and understanding that no matter what I thought I knew, she was always the one that we had to listen to and follow and direct. And being that she was an older mother going through the process and hearing her and being next to her and how she had to fight with the system in its totality to really reflect. I really am looking forward to being a part of changing this narrative for other mothers as they come through the process. Thank you for having me.
Thank you so much. So I want to talk about access to birth support. And I think that our last 2 testimonials were a really good setup for this question. So obstetricians and gynecologists are overrepresented in the scope of birth support that is universally available to women, at least in the United States. So, and we also know that there's an overall shortage of maternity care providers and a shortage of Black providers in this space. But we also see increasingly women want access to alternatives such as home birth, such as midwives, and then non-clinical support, such as doulas. So how do we, from a policy perspective, ensure that women have access and birthing people have access to the care and the birth support that they want? And how do we legislate that in our state? There has been legislation in other states where doula support is paid for, and we don't yet have that sort of legislation in Pennsylvania. So can we talk about making sure that our birthing people have access to the birth support that they want and have choice?
So I'll take a stab at it, and I'm gonna defer to my more knowledgeable colleagues. But I know that at some point we have been approached around even the training and building the pipeline for more alternative professionals coming through our system and a partnership to try to create more doula space here locally with the Pittsburgh Public Schools, and trying to figure out that pipeline. And then how do you get that not only in the pipeline for professionals and have the folk who are available, but like you said, how do you resource it and pay for it? And so we have been trying to figure out a way to use some of the educational and labor dollars that they don't recognize this as a high priority industry or field. But now that we're seeing that this health equity conversation is raising to the top of a priority list, especially from our state governor, from the governor who's talked about health equity as it relates to the pandemic. We're trying to see if there's a way to use some training dollars to put into the pipeline to create more space for alternative professionals, but also to help them access resources.
Thank you.
I think another, some other things that we got to do, and it happens at the state, but I think we have to do it more. I think advocacy has to become stronger from the east to the west. And I think that we need to have more days in Harrisburg where we're talking about Black infant mortality. We need to have a day just on that, like we have a day on other things. So, because Harrisburg is always an inside-outside game. We can write the legislation, but what impacts legislation is how fierce the outside is, the advocacy game is in regards to coming to Harrisburg, speaking into existence what we want. So that's number one. I think we just need to do more in regards to being an advocate for that level of change. 2 was more education. The one thing about the town hall meeting last year was that education is critical. A lot of people don't know. They just don't know. Particularly, when you're talking about low-income communities, they don't know. All they know, they're pregnant, they're trying to find a kid. They don't know about the different avenues that they can take and what they can do. That's why I send them your way, Jada, when they call me. But at the end of the day, there needs to be more information, more education going on about that. And then thirdly, I think Rep. Wheatley hit it on this training. Training dollars have to go to some of these programs in order to really empower them and bring them forth. But it starts with advocacy. Rep. Cephas said it best earlier. We're pushing it in Harrisburg, and as you can see, she's a leading force on this. But at the end of the day, if the advocacy groups are not coming up there talking to Democrats and Republicans about why this is important, about why we need to change this legislation or introduce legislation that's going to give these alternatives a new movement, then we're not going to move anywhere. So I think us working together, like we need to do another town hall meeting right here in Pittsburgh, right? We did one last year. I know it's a pandemic, but this would be beautiful if we was Facebook Live right now and a lot of people being able to hear this great information. This information right here is a testimony to heal somebody. So I think another town hall meeting with moms, like the moms, Faith, I'm so sorry. I know you, Faith, and I never knew you went through that. There's other mothers that need to hear that. There's other mothers out there that need to hear just that right there. And so I think that we have to continue, one, advocating, educating, and make sure that we got training dollars.
Thank you.
And I'll just, echo what my colleagues are stating. It's important right now that we play the inside game in the outside game. Like, one, of course, we want to usher legislation through where we're not just certifying doulas, but we're licensing them. They're getting the actual reimbursements that they are working for in an equitable way. But also, how are we certifying midwives additionally to, again, allow for more workforce, health workers to be a part of the workforce in the continuum to, again, increase access. I think additionally, one thing that I begin to think of as Summer Lee was speaking is that if you can imagine, it's an uphill battle to get legislation through Harrisburg. So the question is, what is the will and what is the advocacy on the ground to implement some of these policies that we're fighting for? And I'll give you an example of that. In the city of Philadelphia, we didn't wait for the Commonwealth of Pennsylvania to establish a maternal mortality review committee. We were one of the first cities to establish a review committee throughout the entire country back in 2010, because we recognized that we had a problem on the ground and we needed to dig a little deeper into our data to figure out what is happening. So as a result, we created that. Additionally, we knew that implicit bias was a challenge, and we did not wait for Harrisburg to get our birthing hospitals to start training their medical professionals on what it is to have implicit bias or cultural competency. Additionally, there's so many foundations in the city of Philadelphia as well as Pittsburgh that want to invest, so many companies that, want to say that they are for Black and brown communities right now. Well, where you spend your dollar is where you spend your priority. So if you truly believe that you want to help Black and brown communities move along the needle when it comes to this particular issue, then you need to invest. So we were able to get the Merck Foundation to invest in a training program specifically for doulas that also provided them reimbursements to help support birthing people in Philadelphia. So again, legislation is great, but unfortunately, you cannot legislate racism, and some of our cities and some of our birthing people cannot wait for Republicans in Harrisburg to get that we are in a crisis, that we've been in a crisis prior to COVID-19. The additional thing, I think Representative Wheatley brings up an amazing point when it comes to training dollars and really creating that pipeline into this line of work. I have an opportunity to sit on the Pennsylvania Workforce Development Board, and I'm constantly bringing up, as we're talking about the need for more healthcare workers, what are we doing in the maternal health space? We have the data that says that we need more access points for people, and COVID-19 has shown us the mistreatment of hospitals. Not that, again, I'm against a hospital birth, but having experienced what my younger sister went through in a hospital was a travesty. It was so impersonal. It was, checking off boxes. It was, are you experiencing depression, which is an aggressive question in itself. It's, making assumptions. It's, not really taking the time to understand your patient. And she even was considering doing an at-home birth, but because she had to pay out of pocket for an at-home birth that just was not a financial option for her. So it's going to be critical. Not only are we training people to send them through this pipeline to, create more access to birth workers, but we also need to ensure that insurance companies are adequately supporting birthing people with whatever decision that they want to make. There should not be only reimbursements when it comes to you being in a hospital. When you want to have a different birthing plan, which COVID-19 has forced us to do, forced so many people to do, but recognizing that their health insurance and Medicaid did not support them in that decision is discriminatory. So there's a lot of things that, we can do legislatively. God forbid if we get the Republicans on our side, but I do think, we really need to look, because this issue needs to be solved in the immediate. We really need to look at what opportunities we have on the ground to fund some of the initiatives that we're talking about.
Hey, Jada, if I can jump in just before Rep. Cephas brought something I wanted to crystallize. I'm first term chairman of professional licensure committee. And if we're talking about pulling forth to licensing and figuring out how we can get them into that pipeline, I would love to work with all of you on this call to try to figure out how we can do that through the committee. I do think there's opportunities with the environment and the surrounding time frame that we're in. There's a lot of focus around addressing systemic issues of racism and disparities. I think the governor has a commitment. He's at least expressed the commitment to really want to try to attack these in all frames of our state government budget process. So I think there's a time frame over the next 2 years for us to really take advantage. So I'm looking forward, and I guess I'm challenging you all to work with us to really figure out ways to do that in the most appropriate way.
Thank you. So we've touched on some of the workforce related issues that feed into either our ability to protect lives or those things that make it harder for us to be healthy. So a large share of our maternal deaths occur postpartum. And the United States is the only country not guaranteeing birthing people access to provider home visits postpartum or paid parental leave. What are some of the things that we can be doing to support paid parental leave?
Again, I think that comes from the advocacy. I know that we've had bills in Harrisburg that supported that right there. But again, as Rep. Cephas has said before, passing legislation in Harrisburg is hard. It's not as easy as it sounds. I mean, getting a lot of these Republicans on board to even understand why we have to do this to dismantle systematic racism and some other things have been a very difficult battle. It's a battle we fight every day, but we have to continue to fight it. So I think just from an advocacy standpoint, again, we need you. This is where I agree with Rep. Cephas and Wheatley that, we have to work together to get this change. It's not just going to change in Harrisburg. And I think that's some of the things that we think happen. We introduce a bill. We can't even call, if you're a Democrat right now, any bill you introduce, you can't even call up in your committee. You know what I mean? Because we're not the majority committee. They call up the bills, which will be the Republicans. And then you got to vote it out of committee before it even gets to the floor. So that's where we need the advocacy to be able to talk about where's the bill at? I mean, what committee the bill is in, who we need to talk to get it out. That's the back and forth that I was talking about earlier with advocacy. And then the other thing is also that, because we can't wait on Harrisburg, and you've heard all of us say that, there also has to be coordinated care right here in the city of Pittsburgh, where we talk about coordinated care where people can get help from whatever they want to do. The coordinated care helps to remove a lot of the obstacles that's in the way right now, because if we created an infrastructure of the coordinated care, we can begin to tell people where they got to go in order to get the assistance that they need. Everybody knows where I start at, but again, they got to move from there to other places. So for me, those are the two things. I know a lot of people that's talking about those bills right now. The key is helping us get it to the floor and get it voted on and get it passed and move to the Senate.
Thank you.
I would add that, again, we are in a unique period right now where people in urban settings like Philadelphia and Pittsburgh are not just feeling the pressures of COVID-19. People in suburban Pennsylvania, people in rural Pennsylvania, and not that there's anything great about a pandemic. The pandemic doesn't care if you're blue, or red, doesn't care if you're a Democrat or if you're a Republican, it's hitting us all the same. Sometimes even worse in suburban areas and suburban areas and rural areas, because they don't have the hospital systems that we have. And I mentioned a stat in my remarks earlier that 2.2 million women have left the workplace, according to the National Women's Law Project. And if right now is not the time to be against something like paid family medical leave, I don't know what situation we need to be in to understand that that is not a policy that we need now more than ever. And again, all those 2.2 million women aren't just coming from Philadelphia and Pittsburgh. Again, they're coming from those rural counties. They're coming from the suburban counties. If women are leaving the workplace, that will impact their ability to get back into the workplace and start off at the salary where they were at. That messes with their retirement plans. That messes with their ability to, climb the corporate ladder, whether that be because of lack of access to childcare, because, our childcare systems, which is, a significant number are from Black and brown individuals, they're being decimated as we speak. So many childcare centers closing, impacting women who take on more of the burden. Nothing against the men, but they do take more of the burden when it comes to, family life, or individuals forcing to be caregivers at this time, given the impact that COVID-19 has had on our senior population. So there's so many different pressures right now for, women in the workplace, that something like family paid medical leave, or just family leave in general, parental leave, whatever kind of leave you want to call it, is critical now more than ever. As you see so many families falling through the cracks because women are majority of heads of households in Pennsylvania. And surprisingly enough, I don't think I've only been here, this is my third term. I've never seen a Republican introduce anything close to medical leave. And we actually have a Republican female that introduced family leave this legislative cycle. Now, is she committed to doing the heavy lifting? I don't know, but she has to answer the same questions we have to answer in Philadelphia and Pittsburgh as she does in her rural area, as to what are you going to do to help protect me economically? What are you going to do to provide resources for COVID-19? And if she doesn't have an answer, we'll be fine. We only have primaries. They have primaries in the general. She has to respond to the economic conditions of so many people. And I think now more than ever is something that we need to, family leave should be something that we should be considering.
Thank you. So my final question before we move to the Q&A portion, where we'll address questions that have been placed in the chat, is, in addition to racism contributing to maternal and infant mortality, another major contributor is significant underinvestment in family support and healthcare programs. Many programs that support families in need, such as Medicaid and TANF, have experienced funding stagnation and very little program improvements. This has been particularly harmful to families of color who are overrepresented in these programs due to barriers to economic opportunity, which is attributed to structural racism. This is one of the major drivers of social determinants of health. Are there legislative efforts to invest in and expand access to policies and programs that support families' basic needs?
So I'm going to try to address this. This is a very complicated and question, because it really talks about systems. And the way I approach this is, I think our systems, no matter what we're calling them, they're not aligned, they're not resourced appropriately, and they don't address the needs when the people need them, how they need them to pull them out. And I'll just use one example of this. And I talk about this as it relates to, we have a policy to try to get more families, parents to work. But we know many of our moms, especially, they are also heads of households where they have children, many of them young children. And we have a childcare system that really isn't funded appropriately, and it's not structured appropriately to meet the demands that the moms need to go to work, stay in work, and progress in work. Meaning, if I start off and I'm in the second or third shift, it's very hard to find quality childcare that's going to go beyond 6 o'clock at night. And so there's a misalignment, and we really need to reevaluate the systems and how they play together. Because I think of course, we can always prime the pump with more money, because in these systems, many times we actually have the moms working in systems, and they're underpaid, undervalued, and we're pumping more money into the system when we should be doing it a different way. So I really think that we need to take a step back and realign, redesign these systems, realign these systems, and then start resourcing them in the ways that we need them to grow.
Yeah, I would agree with that. And then secondly, I think that this is purely racism. Because years ago, when the reflection of the population that was receiving these services looked different than us, they were pumping more money into it because it was a way of an infrastructure to get people to the middle class. So they had no problem in pumping money into these programs because it was helping them to fall so that they wouldn't fall outside the safety net. Now, all of a sudden, the population is changing and the reflection is racially changing. Now you see all of them want to cut it. But these were the same programs that they were investing millions and millions of dollars in to ensure that they had safety nets with an infrastructure to get people to the middle class. Now, all of a sudden, it's cut. They keep cutting it because the racial composition has changed. So that's a direct reflection of racism. I think one of the things that we got to do is we got to continue to advocate more and more for exactly why these programs need to be funded. Because if we don't begin to advocate on a level that says we still need these programs, here's how many people it's helping, and look what it's doing from an infrastructure standpoint to move people to a quality of life in which they can take care of their families, then we're in trouble. And so we got to constantly fight for that. The systems, we always have to change the system. Representative Wheatley is right there. But we got to make sure that these systems are properly funded like they were back in the day, helping people that's racially wasn't reflective of us. We have to continue that fight.
And I can only echo what both my colleagues stated with Rep. Wheatley, Chairman Wheatley, about realigning the system, redesigning the system. When you have 53% of the maternal mortality deaths coming from Medicaid recipients, obviously something is wrong there with the system. I think secondly, to Rep. Gainey's point, you had this country for a while during the Reagan administration paint those that just are in need of social supports as Black welfare moms. And, once that narrative began to enter into political discussions, policies tended to change, lack of investment, lack of supports. And again, I'm of the opinion that when you don't strongly support a system that can help lift people out of poverty, you're only going to shift the burden to another part of the system. And it's almost like if you don't take care of it now adequately, then you're going to be taking care of it later. And again, they've been in the legislature as longer than I have. So I could be just a little still optimistic. But, when you have a country spending $1.9 trillion across this country and the billions of dollars coming to the Commonwealth of Pennsylvania, again, we should not be having these same conversations post-pandemic. With all of the resources and investment and the focus on equity, if they really mean creating health equity, we need to ensure that it's realized on the ground.
Absolutely. Thank you all so much. Today is the start of more conversations around what we need to do. Definitely have heard a clear call to action for us all to get involved, but definitely as convening this meeting, Healthy Start and the Black Women's Policy Agenda, we definitely hear the strong call to action to be in Harrisburg, to be at the table, to bring our moms and bring ourselves and continue to advocate and educate. So at this point, we're going to transition to Q&A from the chat. From those who are with us in attendance today, and hoping our legislators can stay with us we just have 15 more minutes of your time. We have 3 of our community action networks who will facilitate questions from the chat: and Gina Thompson, Rochelle Jackson, and Latavia Michael. Thank you.
Good morning. Our first question is actually a 3-part. So I'm actually going to just break it up. And for Ms. Mendez, who asked the question, if you wouldn't mind, we would try to answer the remaining part of your questions via email. So the first question is, I sit on MMR committee for state of Pennsylvania, and we are actively reviewing cases, and I have not given formal recommendations from our deep review. What are some policy approaches to address inequities and structural racism in hospital systems and coordination of care, but also outside of the medical system, giving health along life course continuum before and after pregnancy? I can repeat that. What are some policy approaches to address inequities and structural racism in hospital systems and coordination of care, but also outside of medical system, giving health along life course continuum before and after pregnancy? And that was actually addressed to all of the panelists. Thank you.
Well, I will take a stab at it. I know that we have, once again, we introduced it last session. We once again are planning to introduce it this session, where we're trying to have racism elevated to a public health crisis status, which would then create and institutionalize a roundtable or commission that would take all of our state systems and kind of look at them for the inequities that they may have built into them, and then to try to drive our budgetary decision making. It's kind of like our appropriation process. We would try to drive our budgetary alignment to try to address those inequalities. So that would include our medical and health systems primarily, but we know health is more than just your physical health situation. There's a lot of things that play a part of that. Is your labor or your work or lack of the work. It's the other things that play into the well-being of a full person. And so our hope is that once we can get that accepted and in place, we can then start to systematically address inequalities that are built into systems, right? Until we really take the step back and say the foundation of these systems were built on racial inequities. So we're going to always have them until we step back and reevaluate them, and then try to realign them, redesign them, and then funnel whatever we're going to funnel moving forward through them.
You know, that's a heavy question. And I don't think there's like one answer to it, because racism is in all systems. In every system that we got, we're going to have racism. And to dismantle racism is something that we worked on long and hard. I mean, not just my generation, multiple generations before me. And we've made progress, but it still exists. And so I think when you're talking about examining, all the departments at the state, trying to figure out where these racist policies and the legislations that was passed that made it difficult from a health disparity situation to an economical one, to a social one, we see right now the attacks on them. We can't even pass minimum wage. The general assistance we couldn't even get. We're trying to get a health disparity roundtable to talk about the disparities in health. There's so much. And, to be able to break down that question into like different sectors, that's a lot. That's a lot. And I think what you've heard everybody say recently is us trying to do it in many different facets. And what you guys are doing too out there, advocating for Black infant mortality rates to come down, trying to remove some of the racism out of some of these systems that we're talking about. I don't know if there's one answer. I don't know if there's one answer. I think we've given you many answers to what we're working on to try to solve a lot of these issues. But that right there, to me, is the foundation of everything. How to systematically we break down some of these racism policies and legislations that's put in place that holds us back. And as long as we have a Republican, we'll always have a Republican Party that we're trying to educate on why this is important and why what benefits us actually benefits them. The one thing about Harrisburg I learned when I got up there, they got areas that's more poor than most projects in my city, but they will still vote to cut education, vote to cut social programs. So they're so staunch in that racism that they'll cut their nose off their own face just because they think they're hurting somebody else. So trying to dismantle all that, we have to break it down into pieces to get to where we want to go. And I think you've heard all my colleagues today talk about how we're working on that to get that done. But that right there, you got to take a bite of that apple one bite at a time.
I think the only thing that I would add is you mentioned that you sit at the Maternal Mortality Review Committee for the Commonwealth of Pennsylvania. For everybody, for information purposes, this review committee reviews every single death outside of Philadelphia and tries to get at the crux of what happened, could it have been prevented, and what are the recommendations moving forward. So you sit at a very significant table that not only will look at data, but will also drive out policy. And I think there is a role for everyone to play, not just the legislator, but the policymaker, the healthcare worker, the data analyst. And if the question is, how do we root out racism or address inequalities and racism within our healthcare systems? You have to call it out at every single table. So as the review committee develops their recommendations, how are you calling out structural racism within the systems that are used to help birthing people stay alive? And I think the way you do that, again, is as you're issuing your report, your recommendation, looking at every policy recommendation with a lens of racial equity. And I think having the conversation, being bold about having the discussion. Again, this isn't my wheelhouse. I am not a medical professional. I come from city council with a community development background. But understanding that a lot of our systems, across so many systems, racism is at the crux of why Black and Brown communities are being left behind intentionally, is only going to be solved by people like you at the table. Again, digging into data, making policy recommendations, calling it out explicitly for what it is, and creating and recommending policies that will address it with that health equity and racial equity, racial justice lens. So I think, again, not just us have a role to play in this, but also our medical professionals that are looking at data and making policy recommendations.
And Jada, if I can, I know I don't want to belabor, but I need to make this point. I mean, because I don't, at least for myself, I don't believe policy alone changes racist systems, right? And when people look at it, policies only create an environment for how we could look at outcomes and judge and hold accountable to outcomes. But they also, we have to make our systems, we have to kind of address the systems so that we can hold ourselves accountable. So we need to collect the right data. We need to be able to analyze it. We need to be able to make sure it's transparent. We need to make sure our money is going the way that we want to incentivize it, right? So there has to also be that stick component, that when people aren't doing what needs to happen as relates to the outcomes that we want, there has to be ways for us to either move resources away from them, retrain them, or whatever. So there's a when Ed talks about this is a very complicated process, we didn't get there overnight. And the people who are in it, even I include myself, the people who are in this system, we're not all knowing, all knowledgeable. And so there are bound to be some errors, some failures. And this is why I say there has to be a constant feeding system from those who are in it, from the moms themselves to you all who are operating with the moms, feeding the policymakers, making sure we understand what's happening on the ground with the policy and the way that we're driving out resources. So that's why I think it's critical for us to always have this ongoing relationship.
And I just want to add one more thing. Let me jump in real quick. The second part of your question, because you put it in the chat, was in reference to the American Rescue Plan Act and what is this going to look like for all pregnant people, regardless of insurance status. We have the ability to dictate what this package looks like for the Commonwealth of Pennsylvania. And as a co-chair of the Women's Health Caucus, there are a significant number of organizations in the Southeast that are putting together policy recommendations for how this rollout looks. But one thing that we are missing is the voice from the West. And right. To Rep. Gainey's point early on is that this has to be a conversation that the entire Commonwealth is having to ensure that we're impacting as many people on the ground, both in Pittsburgh, in Philadelphia, and in the middle. So one thing I would challenge this group is to stay involved in this conversation. And as somebody that's a part of the MMRC, you're the best one to tell us what this needs to look like to have a significant impact on birthing people in Pittsburgh.
The other thing that I want to just bring right back up is that's why I talked about the coordinated care and how we coordinate in this region in regards to care. Because one, it strengthens your advocacy. That's number one. Two, it provides an infrastructure where people know that they can go to get help, particularly when women are pregnant and they're looking and they're searching. That's number two. And three, it also helps them to be able to identify different doulas to work with. Why that's important, why midwives is important. Like the coordinated care system is so important. Because when you come up to Harrisburg and advocate and everybody's on one accord. So I just wanted to re-mention that because coordinated care takes care of a lot of things we're discussing here today.
All right, so we're going to ask one other, we're getting close, time is dwindling down, but we want to make sure we get maybe one or two other questions in. So Mrs. Riley had a question, and her question was, is the monopolization of medical systems and maternal services harming Black women? And this is to all panelists.
The simple and easy question is, yeah, any monopolized system that isn't centered around the impacted population of people, Black women, women of color, whomever, is going to be detrimental.
I would add that, we had a clear example in the city of Philadelphia around hospital closures. We went from, I want to say 13 birthing centers, not birthing centers, but hospitals that are, birthing institutions as well. We went down from 13 to about 5. And we just recently lost Hahnemann Hospital to a equity fund developer of some sort who purchased Hahnemann with the intention to close it because it was prime real estate in Center City in Philadelphia. So not only was it a location that was somewhat easily accessible because, our transit system in Philadelphia, if nothing else, they can connect to Center City. And the area it was located in has been like one of the hardest impacted areas when it comes to the social determinants of health. But with it being closed, they literally closed yet another birthing location for individuals in Philadelphia. So we are seeing that in real time when healthcare becomes a business and they're only thinking about their bottom line. It's essentially putting profits over people. And again, we've seen that in real time. Not sure where you all are on when it comes to Medicaid for all, but what COVID-19 is forcing us to realize, when you don't have access, quality, and affordable care, you are, again, your zip code is going to determine whether or not you live through this pandemic or not.
And we saw that in Pittsburgh, years and years ago, and Jake, help me out with this. There was an organization in the Hill. They were like the EMS. And it was centered around Black folks. And they would come out, I can't think of the name of it though. The name is escaping me right now. But they would come out into the community and they was taking people, they were helping during the birth at all. But back in the day when they were starting to grow, all of a sudden they got bought out. And they were forcing people to go to hospitals instead of giving them an alternative to deal with the organization is escaping me. But
Freedom House.
What was it called, Jake?
Freedom House.
Freedom House. When we had Freedom House, that's what we had. We don't have that no more. So whenever you consolidate and you begin to shrink the amount of the amount of healthcare systems that we have, then absolutely it's a problem. It's an absolute problem.
All right, we have had several questions from our audience, and unfortunately we are short of time and we want to stay committed to what we allotted for this time. And this is a very, very important discussion. I, for one, could sit here all day and have this conversation, but I know other folks have things to do. So we do want to wrap things up. So we're going to, Sherelle is going to give us some closing remarks. I'll follow her with some closing remarks, and then Jada will follow me. But we do want to assure people that we did get your questions in the Q&A and in the chat. and we will do our best to make sure that we can get some answers or responses to those and get those out to you via email. So Sherelle, you're up.
Thank you, Rochelle. I just would like to say thank you to everyone who took time out today to join us for this important discussion. You know, there is nothing as vulnerable as giving birth that someone can go through. And during those times, we only need to be supported because it is such a traumatic event, even though it's such a beautiful thing. And there's no one in this country, regardless of race, color, creed, who deserves to not be heard, to not be valued, and to not be respected during such a vulnerable time. So I appreciate all of our attendees and our panelists for coming together to share this information and to learn some things today. And I hope that you all had some things that you can take away from this experience today that you can share with your family and your friends. And we will be following up with some important information that you can also share out in a few days so we can continue this conversation. So please be on the lookout for that, and please be on the lookout for more events to come. Thank you.
Thank you. And I'll give some just final closing remarks. You know, thank you to all of our elected officials for spending the time with us today, as well as those in our audience, for being invested in being a partner in addressing these issues with us. This year celebrates 30 years of Healthy Start in the community, serving the community, serving women, children, families, and other birthing people, but also working alongside our elected officials, our partners in the clinical setting, and our partners in academia, because it takes all of us. As Representative Wheatley mentioned, policy sets the landscape and the framework, but we still have to do the work on the ground. So we are committed to continuing to do this work on the ground with you all. And as Sherelle said, please look for more information to come. We will be following up on the questions in the chat. We will be following up on some of the important key points that were shared today. And we will absolutely be following up to ask you to continue to do this work with us, whether it's through joining our Community Action Network. Thank you to our Community Action Network for making today possible. This will be an annual event and activity that we are committed to doing, but it won't just be once a year. It's every day that we are working at the policy level to help bridge the gap between what's going on in the community and what our elected officials, what they need to hear from us and how we need them to act and respond so that we have the systems and the environment to improve outcomes for women and babies. So thank you so much. Please do not hesitate to reach out to myself, any of my Healthy Start colleagues, our Community Action Network, or Rochelle at the Black Women's Policy Agenda, she's addressing much more than maternal and child health. All of these issues are very intersectional. So her work spans those other areas of workforce education, et cetera. And as was mentioned in the comments, thank you to Cut and Run Studios who did our back end production to make sure that we had a smooth environment for you today. And thank you to our moms who gave their testimonials today. That really is the heart of the work. As a past Healthy Start participant, and as CEO, I am passionate about both the data and the stories, but we cannot do this work without uplifting the stories of Black women and uplifting the lived experience of Black women. So thank you. And it's 11:03. I think we made good time and we got all bases covered. So again, thank you. Have a great rest of your day, and we will definitely be in touch.
Thank you, everyone.